We're in the midst of an absolute epidemic. Suicide and overdose, it's taking more American lives than we ever could imagine. People who live with mental illnesses are getting more desperate and receiving less help. In less than 2 decades, suicide deaths have increased 30%, drug overdoses have increased 250%. The numbers are going in the wrong direction.
Everyone is affected by someone that has some sort of a mental health disability or a mental health condition. Not only themselves, but their families, their employers, their friends, their entire community.
We've made behavioral illnesses the only chronic diseases in America that we wait until stage 4 to treat.
The opioid crisis has been forefront in the headlines, and we need to do more to help Americans who are struggling with opioid addiction. We also need to remember that there are many other substances of concern that are taking a devastating toll on communities, and funding and resources and support need to be there for Americans who are experiencing addiction to other substances as well.
There are people who really need to understand how important it is to educate people on suicide and mental health.
We have to make sure that mental health is a priority so that the people in our country can live the lives that they want to live.
We can't allow people to continue to die by suicide or go untreated in terms of their mental health or addiction.
It's important for everyone to realize that treatment works, that prevention is possible, and that Americans can live functional and happy lives in recovery in their communities.
As advocates, as leaders, we have tried incremental change, and it hasn't worked. And so I submit that this is the time to fight for fundamental change. This is the time to change everything. In the mental health community, we have a plan. It's called mentalhealthforus.net. This initiative calls for the kind of large-scale fundamental change we've always needed and never achieved. We're organized. We're going to take our platform. We're going to go out and educate candidates. We're going to go out and educate office holders, and we're going to do it in a bipartisan way.
We're hoping to show with Mental Health for Us that there is a huge voter block of people who care about mental health, so that policymakers will stand up.
We can do better than this. We can move health care and behavioral health care into a single system, and we can do it effectively by focusing in on this intervention and this initiative.
Mental Health for Us is a movement. It's an opportunity for Americans of every stripe to join together, to raise our voices, and to demand change and solutions in our communities.
We need to get mental health, addiction services, suicide prevention on the agenda of all our political candidates for office, and especially those running for president.
Policymakers need to know that their constituents, the people that they represent, are struggling with this every single day.
It's really important that people sign the statement of support, because that's how we're going to show that there is a big voter block out there for mental health.
I signed the statement of support because I want to bring policy reform to mental health and addiction policy in our country.
I hope policymakers feel equipped with a comprehensive strategy to address mental health in the United States that's both actionable and will lead to measurable outcomes within the next few years.
mentalhealthforus.net is an opportunity for us to galvanize the mental health community, to speak with one voice, to disseminate what we already know, to be the answers to both suicide and addiction and every other mental health condition. We know what the solutions are.
Mental health will be a long game in a lot of ways, but we think we can make short-term wins, and we've laid out a platform that can accomplish that.